Appropriations Committee to order. We've got the treasurer before us today. We've got the lieutenant governor's office, and then also DSS, I believe. So we're going to try to get through a fairly substantial stack of books this morning. So, Mr. Treasurer, whenever you are ready, let's get started.
Good morning, Mr. Chairman and members of the committee. Before I start, I just would like to praise the committee on last 1 year what the Treasurer's Office has been involved in. We have we had a very successful year with MOBUX, and I am very appreciative of the fact that the MOBUX bill has also perfected in the Senate and has passed in the House to get an infusion of $400 million. Unclaimed property, we returned a record amount of unclaimed property. In most collars, we have received more than about $17 million in donations, and about 1997 scholarships were awarded. And our most account has over $4 billion, and the account has increased by, it is currently at 392,000 accounts. And so is the case with Moable, and I am very proud of my staff that they have worked very diligently and hard to achieve all these great successes in all these programs. We have some NDIs that we'll be presenting today, and Scott Harper, who is director of our unclaimed property, will be presenting those.
You just wanted to hit the NDIs? Okay. We will start at page 7, and that is the NDI statewide pay plan. And that's for most of the staff. The page 11 would be the NDI for the MESAP staffing, $7,000.91. Then if you'll skip on down to page 29 for the NDI STO core pay plan. The governor did not recommend that. We're not requesting that since the governor has put forth his own pay plan. Page 35 is the NDI for Moable funding. This is $45,564. This dollar amount is to help us promote the program. It's replacing a grant that is expiring. Page 47, it's the NDI Charter Schools Capital Funding. This is a program that would allow lending to charter schools for capital needs. They don't have the ability to raise funds the way public schools do. This was something that the governor wanted to put in there. And your page 53 is NDI funding transfer, and this is just the transfer to put the funds in initially. Page 67, the NDI for abandoned fund advertising and auction. That's an increase of $324,993. This is the fund that we use to advertise our statutory advertising statewide. We do our mailings with that. We're seeing an increase in money coming in, and with that, the costs associated with that have increased. Page 89 is the NDI for the abandoned fund claims. That's a $10 million increase, and once again, that goes back to the increase that we're seeing in unclaimed property across the board. This gives us the ability to be able to pay claims. That's the only thing we can do out of this appropriation. And then our last NDI is on page 117, and this is for the debt offset transfer. This allows us enough appropriation to make that debt offset appropriation or interest transfer. This is mostly because interest rates have been favorable, so the amount of the transfer we're expecting to increase. And that would be all our NDIs and our budget.
Thank you very much. Any questions from the committee for the treasurer's office? Does not appear so. Appreciate you coming in this morning.
Thank you.
Thank you. Next up, we'll have the Lieutenant Governor's office. Mr.
Thank you,
Grisham,
Mr.
whenever you're
Chairman.
ready. Appreciate you being here this morning.
Yep, you bet. Thank you, Mr. Chairman. For the record, Adam Gresham, Lieutenant Governor's office. Apologize that Lieutenant Governor couldn't be here this morning. He's on his way. He's at a doctor's appointment, but in the interest of moving the committee along, if you'll indulge me to present it, that'd be great. So thank you. We'll start off. Our budget, just give you a quick overview. Our budget this year is very, very similar to last year's. Last year on the House side, there was an additional $50,000 in personal services that was put in. That was in anticipation of a bill potentially passing that would move the State Historic Preservation Office to the Lieutenant Governor's office. So we asked for some funding on that. That was put in, so thank you all for doing that. That move did not take place, so we pulled that out of our request this year, and so we're actually about $50,000 less than we were last year. If you start in our budget book, the only change really from previous years is the governor's pay plan, represented on page 2. Go on to page 7, our core budget. Again, and page 9, you'll see that we removed that $50,000. Additionally, there was a $2 million expenditure for the Truman Presidential Library that had been put in. We took that out of our core budget as well. You'll see that represented. Move on to the Arts Council. Arts Council funding. Michael and his staff are here today. They're doing a great job. The Arts Council came to us in 19 or 20. And so, again, they do wonderful things where I think we're in 100% of House districts, 90+% of Senate districts, and some of their grant funding. So we appreciate the committees and the legislatures helping in the past and shoring up some of their funding. And so we appreciate that very much. Within the arts funding, there is $3 million that was co-reduced from last year for the St. Louis Symphony. Yeah, sure.
Senator Searpoy?
I may have said it backwards, Senator. If that's what I said, then I said that backwards, so I apologize. Yeah, that would not make sense at all, would it? So I'm sorry. Yes, sir. Thank you. Sorry for that. Again, you'll see the $3 million core reduction. The legislature put in $3 million for the St. Louis Symphony. We took that back out in the Arts Council core. Public television remains unchanged. It's the same as TAFP last year. If you look at the Humanities Council budget on page 33, for the last few years there has been several allocations of money for specific projects that the legislature has put in. Those include the Negro Baseball Museum, Buck O'Neill Center, African American History Museum. Those are great projects, and we're glad to help do those, but those we take those back out of our core request, and so what you'll see in front of you is a budget that backs out those special projects.
Yeah, Adam, a lot of times we one-time those lines under your
Yes, sir.
budget, so.
Yes, sir.
Makes sense.
And we're ambivalent to those, and I don't mean that in a bad way. Those are great projects, and we're glad to help them, but that is not something that we
It was more our prerogative to put it underneath your budget than yours coming to us asking for it.
Correct.
Yeah.
Thank you for noting that, Mr. Chairman. I appreciate that. And then the last pages that we have in our budget, page 40, 47, and 54, are just the transfers that go from the arts and entertainers tax, that go from general revenue via the arts and entertainers tax to the Arts Council, the Humanities Council, and public broadcasting. So with that, Mr. Chairman, if there's no questions, I'll be done.
Thank you, Adam. Any questions from the committee for Mr. Grisham?
Thank you, Mr.
Does
Chairman.
not appear so. Adam, thanks for being here. Next up, we've got the Department of Social Services.
Sorry.
Good morning. My name is Joni Rogers. I serve as Deputy Director for DSS. I am just sitting in. Director Nodell sends his regrets. He's not able to be here due to a family emergency. It is. But we have Patrick Lubring here to walk us through our budget and answer any questions.
Appreciate you being here, and our thoughts are with Robert this morning.
All right, Patrick Lering, Department of Social Services, and I assume we just want to go through NDIs?
Yes.
Okay. I will start with Book 1 of 9 on page 14. This is the pay plan for the department, 11.2 million total, 5 million GR. This is the 3.2% pay increase plus a 10-year based pay increase for Division of Youth Services for the 24/7 staff. Next page is page 52. It is the FMAP. Every year, the feds adjust our federal earnings rate. This year, we had a drop of 0.76%. For the regular FMAP, drop of 0.53% for enhanced FMAP, which results in a GR pickup. It's $79 million total, 64.5 million GR. The rest of that is just right-sizing our appropriations. Next page is on page 81. This is for Senate Bill 186, implementation diligent searches, legislation that was passed last year. The department requested 2.9 million, 47 FTE. The governor recommended 1.1 million and 18 FTE. The next is on page 88 for Senate Bill 35, implementation of license suspensions hearings, legislation again that was passed last year. This was not recommended by the governor.
Patrick, let me just add, this is just one of these kind of pet peeves for me. When we pass legislation, you say this is what it's going to cost, and then we don't get it recommended by the second floor. Help me connect the dots on how we're going to make this work then.
I think there's a little bit, so right now we're, and Sherry Hahn here is our legal counsel, we're not moving forward with some of this right now because there's a legal case involved. So it's sort of a wait and see. All right, page 135, transfer additional authority. This is additional, we have IT authority in our budget to transfer federal funds to IT for the work they do and for the federal funds they earned. So this is a cost to continue the supplemental of $7 million federal transfer authority. Next is on page 187. This is the NDI for the MMAC provider enrollment system. This was actually funded last year as a one-time. This is one-time money. It's a system. It's not getting done quite yet this year. There's probably about an 18-month implementation period on this. So we're requesting that authority, so sort of a reappropriate of this authority. Next is on page 212, compliance and reporting. This is 1,045,578 GR, 466,000 federal. What this is, we need to do more compliance as a department, more financial monitoring of not only our contractors or subrecipients. It's hard for us to hire auditors. So this would give us the ability to go out and contract people with the expertise to do the monitoring of contractors and subrecipients. Next section is page 249. This is the county detention payments, cost to continue, 200,000 GR. We are required under any statute to make payments to county juvenile detention centers. We ran a little bit short. It's been trending down. We cut it, but we cut it a little bit too far in the past, so this is adding additional money for those payments. Next is on page 270, Special Assignment Support Unit. This is Special Assignment Unit Investigators. So just like before we were talking about compliancing, those are auditors. This would be for an investigator. So as we see more severe issues, something that we need a little bit deeper dive in, this would add to our investigative unit to do investigation. That's 1 FTE and 69,000. Next is on page 276, and I'll just tell you 276 and 281 kind of go together. 276 wasn't funded. It is for fraud finder investigations on the SNAP EBT system. There's skimming of cards. We're having fraud out there. That's some issues. This would give us an investigator to help address that. We already have existing investigators who would add to that. There's 2 here that was not funded, but if you go to the next page on 281, they funded 1. Same thing. It's just different NDI. And that is it for the sports book. Is there any overall questions before I move on?
Senator Crawford.
Thank you, Mr. Chair. This is really a question about the EBT. I had my staff ask this question, but a situation was brought to me where a constituent works at Walmart and they're able to use their cards to buy the little liquor bottles with some of those funds. I think they said it was maybe a cash money instead. Can somebody talk to me about that and tell me why we would let that happen?
I do not think you can buy it with SNAP or food stamp
Can't-
money, and so I don't know what that would be.
It's with a card.
It would have
If somebody
to be
can, yeah, can somebody
temporary
talk to me?
assistance, but I can have Kim come up and discuss it.
And are you coming up also, or for something else? Or
Yeah,
you
she'll be up here for book.
You
well,
want to
she's-
just wait?
Well, she's
Okay, just for just easier. Thank you.
she's next one. Yeah. All right, so we'll go to book 2, and helping present that, I'll present, but Kim Evans will come up and answer questions. So.
Good morning. I'm Kim Evans. I'm the Director for Family Support Division, and you were right on cue. So, actually, they cannot use their EBT card to buy liquor with that card. However, with the temporary assistance cash grant, they can get cash money for those benefits. And if they turn around and make a purchase with that cash, then we cannot stop the liquor purchases with the cash money.
So can you not? I mean, can they buy anything with that cash?
Yes,
or
they can.
Anything they want.
Yes.
Okay. All right. Thank you.
All right, we're on book 2 of 9. We will start on page 7. This was the Senate Bill 4590-106. This is for the bill passed last year. This is for submission of the Mo Employment First Act, where we are working with the Department of Revenue to do some forms, allow people to apply for benefits and do their annual renewal. This was not funded by the governor. Not sure why, but I think it was partially due to just prioritization of what to fund, what not to fund. Yeah. The next is was part of that legislation too, but this is the transitional benefit program. The department requested $39 million GR. This is just for the system work. So there is no federal funding with this. This was subject to appropriation. So these are the transitional benefits. There has been some discussion with the sponsor around this, Senate Bill 45 and the transitional benefits, on some cleanup language and how we move forward with a program that actually earns federal funds. As written today, it would be 100% GR.
Senator Arthur.
So along those lines, are you still exploring using broad-based categorical eligibility?
We are exploring that, and we have a call next week with our federal partners,
Okay.
along with the sponsor of the bill.
Can you tell me a little bit? I know that there was a waiver submitted and then a waiver denied.
Yes, and that was on the transitional benefits.
Right. Do you intend to resubmit a waiver, or?
So we're working with that with the federal piece. There's also the funding piece that we're waiting on appropriations. The broad-based categorically eligible is a very large program, and we will need appropriations to be able to adequately administer that program. So there will be additional FTE that will be needed. There will be some system work. It is not as large as if we would be doing the transitional, which requires a separate system to work that. But then there's the EBT, additional EBT cost, and just the administration of the additional households.
Okay. I will probably follow up with you offline.
Okay,
Thank
fine.
you.
All right, the next section is on page 21, Public Health Emergency. This is $16.7 million. This was funded this year. We asked for funding into next year to help as we close out the first round of annual renewals for Medicaid. This will give us authority in case we get further rule changes, for other things we need to do with the Fed, or further systems changes as we move forward. Next section is for summer EBT, cost to continue. This is also included in the supplemental. 13.2 million, 6.5 million GR with 6 staff. This is funding to start up the summer EBT program for children. The next section is on page 107. This is Income Management's Call Center Automated IVR. This is $4 million. These would be for IVR, the call bots, whatever you want to call them, for increased technology to help our chat box, to increase our technology to help us improve our performance on the call center. Next section is page 164. This is $404,000 for our older famous system, even though we're moving to a new Metis system.
Senator Arthur.
If we can go back, what are the current wait times for the SNAP hotline?
For the SNAP, let's see. Do we have the, Nancy, do you have them?
I think there are averages for for all of the programs combined, but I'd be curious about SNAP.
We can get you the
specifically.
current.
Okay.
And it does fluctuate depending on the time of the month. So for SNAP, individuals who are recertifying have from the 1st to the 15th of the month to complete their annual or their interviews to be able to have timely benefits the next month. So your wait times are usually higher at the first part of the month. Let's see. We are looking at an average wait time of right at an hour for your Tier 3, which is our interview line.
And that's specific to SNAP.
That is specific to SNAP. And the request that we have for the NDI would allow us to automate that Tier 1, which that's the general questions, and that would allow us to move 100 staff to this Tier 3
Got it.
to help with the interviews.
Okay, thank you.
Right, that brings us back to page 164 for famous. This is our existing eligibility system. It is slowly being replaced by Metis. However, we still have to do maintenance on the system to keep up with federal requirements. Next section is page 219. As is discussed, we're moving away from famous into a newer system called Metis. This is the third round of implementation. This would be for Medicaid for the adult and disabled. It is for 3 million GR, 30 million total. We'd get 90/10 funds for this. This would be sort of the first round. We would go out for bid for this. We'll have a little bit more information as we come back from bid. Our current estimate is it would cost roughly 50 million. Next section is Metis ECM document recognition technology. This was for 1.1 million. Request from the department. It was not funded by the governor. That brings us to book 3 of 9. All right, first one is on page 362, the blind pension rate increase. This is a rate increase of $39 for recipients of the blind pension. This is funded out of the blind pension fund. Next section is page 400, the business enterprise cost to continue. This is the funding for the Fort Leonard Wood contract, where we have a contract to provide food with through the Randolph-Shepard Act with the local providers. We need a little bit additional funding to make it through this year, and then this would be the cost to continue to carry through that in FY25. And that is it for book 3. And that's the last of Kim Evans. Any other questions for Kim before we move on? All right. We will go to book 4 of 9. Jerry Ann Brennicky will come up as I present this. Just so you know, we've handed out 2 pieces of 2 documents on VOCA. We'll cover that briefly in here, but those are some of the recommendations that have been working with providers and advocates to come up with a new distribution system. There's two, one some more in-depth, and then there's the House asked for a simplified version of what our recommendation is coming out of the VOCA formula, or how to distribute VOCA funds. So that's information. If anybody wants to have conversations, any feedback, this is our recommendations. We'd like to hear your feedback.
Senator Arthur.
I do appreciate you working with us on some of those VOCA recommendations, and I think we've landed in a pretty good place, although I know it's an ongoing process. And maybe I'm getting a little bit ahead, but if the NDI is not funded in the budget, what's the plan going forward?
So right now, if the NDI is not funded, and I'll get a little bit more in depth, or we can just run there now real quick if you want to. So it's 6.19 million. What we're going to have to do is figure out how to reduce everybody's funding. So there's basically two different methodologies we're looking at, and sort of two different decision points. One is to have that reduced amount go through those sub-grantees, and then they would provide it out to all the people in that pot. Or we just percentage relationship, everybody, except for those below 50,000, we hold those harmless. On the minimum side, we move that from 200 down to 50. But everybody else, and say that doesn't get funded, we look at the dollars we have, because it sounds like the feds are going to reduce their grant too, and say we've got 50% of the funding, and everybody gets reduced by 50%.
Okay. Again, I appreciate your willingness to engage on this issue. Thank you.
Yeah, no, and we appreciate your input. It helps us. We're trying to do what everybody wants. So,
And then we've got another question from Senator Black.
Thank you, Senator. And this isn't directly at this portion, but there's a chance I'm going to leave, and I want to make sure that I get to ask that. When we put the Office of Child Care together a long time ago, if anybody was sitting in that when we discussed this over on the other side, my concern was that the silos that are already built around each one of those support systems, except for children, it would be awful hard for divisions to break down those silos and cause conflict or problem actually for kids. I don't know whether this statement is that, but I do want somebody to come to my office. The funds that we put out in the state to help support children and daycares, I think that the majority of the problem seems to be a new DESI payment system, but I also have enough intelligence to know DSS, part of those students or part of those kids are still within that system, right? On the foster care side, am I accurate with that or not? And,
Yeah,
and so you don't have to answer this, but I do want somebody to show up. As I listen to the constant complaints from different, even a senator come to me yesterday, what do I do to fix this? I sent them to DESI because people aren't getting paid right now, including people that are watching foster care kids. It's causing financial hardship, even though we've thrown all kinds of money at different parts of child care. I want somebody from this group to come tell me, Rusty, this is where our line stops and somebody else's line starts on that, making those payments. And I think right now those kids are in foster care. Is it 6 months? How often do those families have to recheck into the system? They automatically get booted out, et cetera, et cetera. So obviously it's not to be answered here, Senator, but I thank you for letting me bring this up publicly over a microphone. Come to my office. Try to make me feel better about the system, because I don't believe this is a part of mixing those divisions and making this new division that hasn't worked well yet. And I think it's been 3 years.
yeah, we will have somebody schedule an appointment with you and meet with you on this before break. That brings us to book 4 of 9. The other thing, before we get into this book 2, we sent some information over last fall just to make everybody aware of this issue. It's not an issue yet, but because the rule has not been finalized in TANF. They're proposing a new draft rule on TANF, which will make significant changes to our TANF program. This could cost the state $50 to $90 million, depending on how it gets how the final rule reads, we lose the ability to do third-party MOE, which means all of our those great public-private agreements we have with the food banks and after-school programs go away. After-school care and some of the educational components around 16 through 24-year-olds go away. So there's a lot of different components to this. Long story short, it will if it is finalized the way it is, it will have a significant impact. There was a lot of pushback on the rule on a broad spectrum from a lot of different states, from a lot of different angles. So we don't know if it'll be finalized. If it is, you know, hopefully they will give us a 3-year runway, because we're going to have to bring some experts in and spend 6 to 8 months to figure out how do we basically rewrite our entire TANF program so that we can bring information to you guys to make decisions. So I want you guys to know that it's out there. Hopefully it doesn't get finalized and they try to make us go live October 1, because even if that gets dropped today, I don't have good answers for you guys today. All right, with that, we will run through book 4 of 9. The first one is on page 551, and that's Jobs for American Graduates. That's 3.75 million GR. This is a replacement of TANF funds. I think this is one of the areas that we were concerned that wouldn't be funded with the new TANF program, and the governor's office recommended just go ahead and before anything would happen, fund it with GR to make that clean. The next is an NDI for Mission St. Louis. It is on page 600, and it's $500,000 of TANF funding. And this was one-time funding that was funded in the past that is being repeated. Next section is the NDI for out-of-school enrichment, page 642. This is $7.265 million. These were funds that were previously in DESE. These were for after-school programs in Kansas City and St. Louis. Previously, they were moved from Department of Social Services over to DESE. They are moving that program back to us. Next is on page 726, Domestic Violence Award Authority. This is for $500,000. We think we're going to have some additional grant funding coming in for this program. This will give us additional authority to distribute those funds. Next is on page 769. This is to help support the VOCA programs and offset the reduction of federal funds over the years of $16.9 million. We originally thought this was going to be enough back in January, late December, if our grant amount remained the same, to hold us steady for this year. Now we're finding out that our grant may be cut another $7 million at the federal level. There's a lot of advocacy at the federal level, a lot of discussion to see what they can do. We're not sure what's going to happen yet. So just to warn you, even if we get this, if that falls another $7 million, we will have to reduce all those contracts by $7 million. And that's it for book 4. Next up is book 5 and 9. That's Children's Division, and Daryl Nissy will come up and help answer any questions as I run through the book. Before we start for Children's Division, is there any overarching questions that anybody has? Okay, on page 6 is the child welfare cost to continue. The supplemental of $3.8 million. We had updated projections after we did department requests, so this is no longer needed. Next is on 4B grant caseworker visit enhancement. This is $2 million federal funds that we had the chance to get. We didn't realize until after Gov's rec that we are not getting this, so this funding we are no longer getting this $2 million. So we still have the authority because we weren't able to get to the governor's office in time. The next is the CWIS FACES support new decision item. As many of you are aware, we are in the process of rebidding and doing our FACES system. This request was for $853,000 GR and 12 staff. Right now what we want to do is bring in staff from the field to have input into the new system. They're the ones that use it on a day-to-day basis, have the most knowledge of what's needed. This would help backfill those staff, but right now we'll just use existing staff and work with that without these staff. Next on page 63 is $3.4 million. This is for new fleet for staff to allow a lot of individuals out there to have state cars as they do investigations and visit parents. This was not funded, but in the ARPA bill, House Bill 20, $1.12 million for 33 vehicles was funded. So some of this got funded in there. We originally thought when we went forward we'd have that $2 million federal. We were going to purchase vehicles with that to make up the $3 million. This was sort of the alternative, and at Gov's rec we didn't think this was funded, but the governor did go ahead and recommended $1.1 million in the House Bill 20. Next is page 68. This is the second phase of our Children's Division reform and reconstruction. This is for 50 staff and $3.7 million, $2.8 million. What these staff will do is they're going to help recruit foster parents and help maintain those placements or foster families. Right now, you know, it's estimated we need close to 6,000 homes. I think this will add, right now we have around 3,000 or 4,000 homes if I recall correctly. This will help us add and help maintain an additional 2,000 homes. So it's another step in the right direction for Children's Division. Page 73 is 2 FT and $179,000 for an additional 2 circuit managers in St. Louis. At one point, those managers went away and we consolidated underneath one. That's not working well for the administration up there with all the needs and everything going on. They need additional staff to help manage the work. Next is on page 119. This is a Bachelor of Social Work program. This was a proposal by the department, was not funded by the Gov's rec, governor's recommendation. This would be basically similar to our Master of Social Work. We would help fund college education expenses for individuals to get their BSW in social work. Next page is on page 220, Family First PSA. This is $9.6 million, 500,000 GR, 9.1 federal. This is our Family's First plan that we're moving forward with. This is a reappropriate, so every year it gets put in as one time, and as we spend it down, this will get reduced. But this is a reappropriate from last year. And that's it for Book 5. Any questions on Children's Division? Oh, we do have one more book for CD. Book 6 is also Children's Division. This is on page 332 of Book 6 is a management contract. Last year, $5 million was added of some one-time federal funds to help add a case management contract to assist in St. Louis. This is one-time funding, so it gets cut as a one-time, gets reappropriated. We're thinking we'll spend about $2.5 million over 2 years period. Any other questions? And page 414 is the Chafee aftercare increase. Over the years, we've been building up a balance in our Chafee fund. This is for $2 million to help spend that balance down and also to address issues such as the apartment places for kids coming out of care. Right now, our rate just isn't sufficient enough to help get those children placed. This would help us increase that rate. Plus, we would add some money to both the independent living and the transitional living contract. And that's it for Book 6. Book 7 is Division of Youth Services. There are no new decision items in Division of Youth Services, but we do have Scott Odom here, the Director of DYS, if there's any questions for Division of Youth Services. All right, so that brings us to Book 8 of 9, and that is Mo Health Net Division. And to help present that budget, Todd Richardson is going to come up and present.
Good morning. I'll start Book 8 of 9 on page 9. That's the Mo Health Net cost to continue. Explanations for what all is in that cost to continue can be found on page 10. Total request here is $390 million, all funds. Two explanations that drive most of the cost to continue here. First, the FMAP change that Director Lubring mentioned at the outset, and then also better numbers as we move from department request to GovRec. Next on page 36, this is our managed care actuarial increase. As the committee knows, we're required to set our managed care rates in an actuarially sound manner. This represents the increase needed to do that for this year. $124 million all funds, which represents an increase of about 2.5%. Next on page 50 is the NDI for the pharmacy specialty drugs. Pharmacy specialty drugs are drugs that have a monthly cost of over $600 a month. We pay for these in a fee-for-service manner, but we estimate the cost on a per member per month. Total request here is $48 million all funds. The flip side of that coin is the non-specialty pharmacy trend. Same story here. We estimate what we think that cost is going to be on a per member per month basis. Only $15 million is the request here. Next on page 68, this is the NDI for our PACE rate increase. PACE is Program for All-Inclusive Care for the Elderly. We currently have three PACE sites, we have two PACE sites operating and another PACE site on the way later this summer. The increase here is $436,000. Next on page 75, this is the NDI for the outpatient fee schedule trend. We transitioned our outpatient payments to hospitals to a Medicare-based fee schedule 3 years ago. This is the NDI that represents the increase in those Medicare rates then flowing into Medicaid. Total request is $17 million. On page 80, this is an NDI we're requesting this year to restructure a portion of our budget. It doesn't mean anything different in terms of the program, but rather how we account in the budget books and in the budget bill for our FRA funds. Some of you may remember that what you would have seen in years past is a large NDI at the end of the budget, which would be the FRA. It would include both the tax dollars and the federal dollars that are drawn down with those tax dollars. What we're doing here is breaking that out into other funds and then the appropriate federal funds that are being drawn down by those provider taxes. And so you'll see that change in a couple of places because we need to core cut some of those other funds and then add back the federal dollars. The request here in this NDI is the adding back of those federal dollars. So it's a large item, but doesn't represent an actual increase in spending versus what you would have otherwise seen. Page 87, this is additional IGT authority for the adult expansion group for our DMH population. We use that IGT or intergovernmental transfer authority to help account for the state share of services provided by the Department of Mental Health. This is the portion that we need for federal authority to cover the DMH expenses for the adult expansion group. On page 109, an NDI for diagnosis-related groups, or DRG. This represents planning and implementation cost as we transition our inpatient hospital payments to a new system. That new system will be diagnosis-related groups, or DRG. I believe we talked to the committee about that in the past. $1 million all funds is the request here. Page 113, we no longer need this NDI in favor of the next one that is listed on page 120. This NDI is for only one FTE, but $763,000 of PS funds. This represents a pretty significant expansion in our information services and our data management capabilities. So with restructuring some of the existing FTE we have, plus this additional PS dollars, it's going to allow us to add about 10 staff members split between our information systems and our data management group. It's a very significant and very important increase in capability for us. On page 127, this is an NDI for one FTE, or the equivalent of one FTE, although the FTE itself is zeroed out. Department requests to GovRec. The PS dollars are still there. We actually have a vacant FTE that would cover this. This would give us a dedicated staff member to work with a new tool that the General Assembly appropriated to us to ensure that our managed care companies are staying in compliance with their contractual requirements. Page 174, this is an NDI for an increase in our operational costs for our MMIS systems. MMIS is not one system, but a collection of systems. This is anticipated increases in the contracts for the vendors that help us operate those systems. Page 178, this NDI can actually be deleted because it's included in the prior NDI. Next on page 182, this is an NDI for a security risk assessment. We have a number of new systems and new interfaces between those systems. since we last did a full-blown security risk assessment. This will give us the resources to do that and really check our updated systems and interfaces. Next, on page 186, an NDI for our pharmacy solutions. This represents some trend. The General Assembly appropriated dollars for us to procure a new pharmacy system. I believe 2 budgets ago. We're in the process of doing that procurement right now. Based on increases in prices, this represents the difference in what we originally thought and what we think the price is actually going to be now.
Senator Arthur.
Thank you. Good morning.
Good morning.
I didn't know the appropriate place to ask this question, but I'm curious if there have been any discussions about Medicaid covering weight loss drugs and what that looks like.
Yes, we've internally had a number of conversations, and it's obviously a conversation that you're seeing take place in Medicaid programs across the country as well. We believe that those products represent tremendous opportunity for the program.
Mm-hmm.
They also represent really significant cost at their current price levels. Weight loss is the one exception to the sort of general pharmacy rule that we have, which is that if there is an FDA-approved drug, we have to allow a path to coverage. Weight loss is a little different in that we can choose to elect coverage for that or not. I do anticipate that you're going to see the division recommend that we cover those products. Now, it's going to be incumbent upon the manufacturers, and there are 2 in the space today, to make sure that they're giving the state good value for that coverage. But when we look at the downstream impacts of obesity, particularly if you're talking about in children or in those who have significant comorbidities, we think that the sort of net value of that to the state and avoided health care costs is going to lead that to a place where it makes sense for us to cover. There are a range of decisions that we'll have to make in terms of what are the criteria. We will likely only cover one of the products, and so it's going to be incumbent upon the manufacturers to make sure that they're giving us a good price.
Okay. Thank you.
Welcome. Okay, we can skip all the way over to 281, and actually the next really 3 NDIs after this one are kind of part of the same story. We did a number of provider rate increases, realigning those rates to a percentage of our Medicare rates. These represent a few things that we actually just inadvertently left out. So the first is for a rate increase for independent labs, as distinguished from hospital-based labs. The one following that is ophthalmologist. We increased rates for optometry services, but actually inadvertently left out the ophthalmologist. And then the last 2, first the autism services, and then I'll save the prenatal care. The autism rate parity, DMH increased rates for autism services. This represents the attempt to get the MHD paid for services up to parity. On page 293, this is an NDI for prenatal care payments. We have been engaged in a pretty comprehensive effort at MoHealthNet to update our program to try to improve maternal and infant health care outcomes. One of the strategies that we're going to employ is the use of group prenatal care. It's not the only strategy, so there are a number of other things, but this would represent the fee-for-service side of authorizing those group prenatal care payments. Okay, that concludes Book 8. Move on to Book 9, page 324. This is an NDI for anesthesia and extraction rate increases. We realigned our dental services payment rates last year, actually maybe 2 years ago, but we did not include the dental anesthesia code, so this will allow us to increase those to get parity with the rest of our dental rates. Page 341, this represents premium increases for Medicare buy-in. The state, for dual eligible individuals, pays for Medicare premiums. It represents a very significant cost savings to the state to do so. As those premiums are increased at the federal level, our costs go up as well. This represents the anticipated increase in those premium payments. Next NDI is page 405. This is a hospice rate increase. Hospice rates are set and increased by federal law, and we're required to increase them. $388,000 is the increase anticipated for this year. Page 421, NDI for NEMT, non-emergency medical transportation, actuarial increase. Similar to our core managed care contracts, we pay for these services on a per member per month basis set in an actuarial sound manner. This is the amount needed to fund that rate for FY25.
Senator Arthur.
Thank you. We've had a number of constituents reach out to us about issues they've encountered with this program. One, her ride canceled, never showed a couple of times, and then she ended up hospitalized, which of course is bad for her and also increases the cost. Another constituent waited for 3 hours in the cold and ultimately had to find alternative transportation. And DSS has been very helpful in assisting with those specific issues, but in terms of the overall quality of the program, is it working as intended? Are there efforts underway to sort of reevaluate how to make things better?
We believe there's room for improvement. Let me say it that way. And this is a very difficult part of the program to administer because we rely on a transportation broker who relies on transportation vendors spread out across the state. And that means that in order for our participants to get the services the way that we want them to get, which is a trip, smooth, on time, every time, it requires there to be a really robust network of providers across the state to do that. We have been engaged in bi-monthly, so every 2-week leadership level calls that include me, my deputy director, and the leadership at MTM to focus on where that performance of that network is. We think there's been a lot of progress that's been made over the past 8 months, and I'll give MTM credit for making that progress, but I think there's still room for us to improve the performance, and we're committed to doing that.
Do you think it's a funding issue and that's why you're not seeing enough vendors, or?
I don't think it's a funding issue in terms of how much money's in the rate. I can't speak necessarily to how MTM's contracting with those transportation vendors, but we believe based on sort of the macro level data that there's sufficient money in the rate to fund the services that need to be provided.
Okay. I may follow up with you.
Absolutely.
At a later time. Thanks.
Senator Crappie.
Just to kind of go along with that, I've got an FQHC that's been trying to work with NTM and not having much luck. So I just want to kind of pile on there, and maybe if you could.
We'd be glad to follow up directly on that and happy to facilitate a conversation with
Thank you.
with
I
MTM
appreciate
there.
that.
Mr. Chairman, the next NDI is 614, I believe. The MOMAPS program. MOMAPS is a program that funds enhanced physician payments using an IGT structure. While that's in our core, this is the AEG portion of MOMAPS funding. And then the last two in the book, first on 677, this is just a non-count transfer of FRA appropriations where we need a little additional authority to account for the state share that's being paid so we can draw down our federal dollars. And then last on page 682 is enhanced FMAP transfer. And that concludes book 9.
Thank you, Director. Any questions for Mr. Richardson before he takes off? Does not appear so. Thanks, Todd.
Thanks.
Thank you. We done? All right, that'll conclude the appropriations hearing for today.